Now see, when we are giving a combination of sacubitril with valsartan to a patient who is already on ACE inhibitor, there is increased level of bradykinin transiently, which can precipitate angioneurotic edema, and that's why there is a need to stop ACE inhibitor for at least 36 hours before the first dose of ARNI is given, so as to reduce this risk of angioneurotic edema. So naturally, if a patient is on ACE inhibitor, let's say enalapril or ramipril, we should stop that molecule, wait for 36 hours and then add ARNI. Now the dose of ARNI, or if the patient is on 5 or 10 milligram of enalapril, that is dose of 10 or less, it is wiser to start ARNIs in the dose of 50 milligram twice a day. If at all patient is receiving enalapril of more than 10 milligram per day, then we can start directly with 100 milligram of sacubitril valsartan combination in a twice a day dosing. Otherwise, if patient is de novo, not on ACE inhibitors, and if the kidney functions are fine, we start the molecule in the dose of 50 milligram twice a day with regular blood pressure monitoring, and every 2 weekly we increase the dose of the ARNI from 50 milligram twice a day to 100 milligram twice a day, and then 200 milligram twice a day. The things we need to monitor are the patient's blood pressure, patient's kidney functions, or any other side effects. Most of the times the molecule is well tolerated, and we can achieve 200 milligram twice a day in quite a significant number of patients. If at all patient has borderline blood pressure, naturally we have to go slow, and sometimes once patient is stabilized on 50 milligram twice a day ARNI, we can reduce the dose of loop diuretics if patient is otherwise euvolemic and there is no fluid overload, and then gradually increase the dose of ARNI so that it is better tolerated. Kidney functions should be monitored at least 4 weekly when we are up titrating the dose. In patients who have borderline GFR, or if the potassiums are on higher side, it is wiser to monitor them more regularly and with a closer follow-up.